Today on Earth Focus, how do you provide clean water and toilets to the poor in one of the fastest growing cities in the world? Documentary producer Stephen Sapienza looked at the challenge in Dhaka, Bangladesh. He shares some promising solutions with correspondent Miles Benson. Coming up on Earth Focus.
Stephen Sapienza, you've made a film about Dhaka in Bangladesh. They've got a problem with water there. How bad is it?
Well, the city's water and sewer system is pretty old. Right now, the total coverage area is probably only about a third of a city that is roughly 15 million people and growing. Dhaka is one of the fastest growing cities in Asia. It's considered a mega city, and it has about 400,000 newcomers each year. And most of these people that are new arrivals to the city are, by and large, end up living in slums. And so in these slums, there's really very little access to clean water and adequate sanitation. And so there are a lot of cases of disease, waterborne illness that threaten a lot of lives of the people that live in the slums. And every year, one of the biggest hospitals in Dhaka treats about 120,000 people for waterborne illness. If you want to see the human toll exacted by unsafe water and poor sanitation in Dhaka, you come here. This is the overflow tent at the short stay unit at Dhaka's main cholera and diarrhea hospital.
This man arrived at the hospital with no vital signs. After 15 minutes of trying to revive him, his wife is given the news. The staff records cholera as the cause of death. The hospital's lead research scientist, Dr. S.K. Roy, and his colleagues work around the clock 365 days a year to save lives threatened by waterborne illness. The majority of the patients here are the urban poor, and the hospital care is free.
We are now having about 400 patients every day. But in August, September, sometime we go up to 1,200 a day. And I can tell you the average of a year is 120,000 patient average in a year. So this hospital is a quite busy one.
The water problems there are kind of wrapped up with climate change, aren't they?
I've been working on a film about climate change and how that's going to impact Bangladesh. And the water and sanitation story in Dhaka is actually connected to climate change. Bangladesh, if scientists' predictions are correct, almost a fifth of the country could become flooded due to rising sea levels in the next 3 to 4 decades. And this could cause about 20 million people to become internally displaced with very few options of where to go. They won't be able to go to India because India is building a fence to keep them out. And so these people will likely lose their livelihoods, and they'll need to find places for jobs and better opportunities. And they'll probably start heading to the urban areas, Dhaka being the biggest draw.
What proportion of the population there has access to clean water, and where do they get it?
Part of the big problem in supplying water to the poor, they do not own the land. So these people have been unable to connect to city water services. And so what they end up doing is paying high prices. They pay almost 15 times more than a person connected to the city water service for their water. And that's because they have to buy water on the black market. They have to buy water from these guys who are water sharks. They drive these carts around and they sell bottled water. They also end up spending a lot of money purifying bad water. So a good chunk of their paycheck every month will go to buying some water, getting sick on this water, and having to purify it. So the poor they're really at a disadvantage when it comes to accessing city water.
Divasa was with the system that was tied with house ownership. That actually pushed us to talk with Dhaka Wasa that why it is not possible to provide water to slum dwellers.
Deebalak Singha lobbied the city to give a water license to his startup NGO on behalf of slum communities.
They explained at that time that they are giving water only to people who has their own houses. So we tried to facilitate that service to slums, linking them with the Dhaka Water and Sewerage Authority.
Linking slums to city water services meant D-Block's NGO assumed the risk if the slum dwellers failed to pay their water bills. But D-Block knew the slum dwellers, who pay 15 times the DWASA rate for water on the black market, would pay their bills.
A win-win situation actually occurred because Dhaka Wasa, they wanted their revenues. On the other hand, poor people, they want the service. And they immediately see the economic advantage of getting access to Dhaka Wasa water supply because that is cheap in comparison to private market.
NGO-backed water access points like this one are now sprouting up in the slums all over Dhaka. Each community forms a water committee that pays to install the pump and for the costs of operation and maintenance. These committees also collect and pay the water bills. The success of earlier NGO-backed water points now enables community groups in slums to negotiate directly with the city for legal water access without NGO help.
What's the one message you want people to take away from seeing this film?
When I started this project, I was thinking that urbanization was the evil in creating all these water and sanitation problems. And what I was surprised to learn was that urbanization, as a matter of course, is going to happen, and that the real lesson that can be learned from what's happening in Dhaka is that it is possible to improve water and sanitation, even in countries where it seems like it might be hopeless. In Dhaka, they have overcome and done a lot with very little, and they've really managed to extend their services and their water services just by changing their thinking and looking at slum dwellers as people who not only deserve to have a city water hookup, but can afford to pay for it and are more than willing to do so.
Stephen Sapienza, thank you very much.
You're welcome. Thanks.
Now on U.S. airwaves, a global channel of uncompromising stories. World news, documentaries, entertainment, and culture. Link TV, connecting you to the world. For more information, visit linktv.org.